can. I just want to make sure that everyone who's trying to get logged in can have that opportunity to get hooked up and connected. I want to thank you all for joining us this morning. Again, my name is Jane Shire with the State Health Plan, and we'll be starting in just a few moments. Thank you. Good morning, everyone. This is Jane Shire with the State Health Plan. Just wanted to check in with you if you're worried that your sound wasn't working. We will be starting in just a couple minutes. We're trying to give everyone an opportunity to get logged in. So if you will please be patient, I plan on starting the webinar at about 10:02. Thank you. Hello, everyone. This is Jane Shire with the State Health Plan. For those of you who have just logged in, I'm going to be starting in just a couple more minutes. We're trying to make sure that everyone has an opportunity to get logged in, but I do want to be observant of your time also. So we're not going to start too late. We'll start in just about another 1 or 2 minutes. Thank you for your patience. All right, good morning, everyone. We're going to go ahead and get started. My name is Jane Shire. I am with the State Health Plan. I want to thank you all for joining us for our webinar, Navigating Your State Health Plan Benefits and Medicare. This webinar is designed for not only people who have retired already and are about to turn 65, but it is also for active employees who are now considering retirement and will be 65, or maybe you've worked beyond age 65 and now going to retire. So you'll learn about how your benefits and Medicare will work together. My colleague Roberta Hamby will be joining us about halfway through. I usually do the first part of the webinar and she takes over in the middle, and then we will answer questions at the end. So as we go through the presentation, if you think of a question, go ahead and type it in the question box, because at the end of the webinar, we will open up all the questions and try to address those during the open Q&A. But certainly type them in as you think of them when we're moving through the presentation. It takes about an hour and 15 minutes maybe to go through all of the materials, so we've got a lot to tell you about. Before I dive in, I do have a couple of announcements to make. First of all, in addition to doing these webinars, Roberta and I usually will start probably late March to crisscross North Carolina and do some on-site meetings on this same subject, and we usually start the last part of March. But due to the concerns over the coronavirus, the on-site meetings for March and April have been canceled. We hope to resume them in May, but there will be no on-site meetings for March and April. The invitations had not mailed yet, however, they had been printed, so you may get one in the mail, but I believe we're looking at putting some type of insert in them that will notify you of the meeting cancellations for March and April. We are going to be adding webinars to the already scheduled list of webinars, so you can certainly sign up for another webinar if you want to. We have lots of people who repeat for these meetings because there is so much information for you to take into consideration as you're making your decisions for health benefit coverage as a retiree. The other item that I wanted to mention is that the plan benefits we will be discussing are the plan benefit options for the 2020 plan year. For our Medicare retirees, we do offer some Medicare Advantage plans, group plan options, and currently that carrier is United Healthcare. But in 2021, the carrier will be Humana. So I'll get into a little more detail on that when we move into the presentation, but I wanted to make these announcements at the top. So with that being said, we will go ahead and get started. This is an overview of everything that I will be covering today, and also Roberta will be jumping in about halfway through to cover the second half of the webinar. First of all, we're going to cover your state health plan options, and then we will go over Medicare a little bit, try to help you understand it. It can be a little bit overwhelming, especially when you're approaching 65. You're probably getting a lot of mail right now from different carriers about options that you may have. So we want to make sure you understand how Medicare works. We'll go over the auto enrollment process, and then we will discuss the Medicare Advantage plans and the 70/30 plan in more detail. We'll review the plan comparisons so you can see all of your options side by side, and then close out with some important information that you need to be aware of. And then we'll open it up for our question and answer session. So let's talk about your state health plan options. First of all, when you retire, if you are not yet Medicare eligible, then you have the same options as active employees. You can have the 80/20 plan or the 70/30 plan with Blue Cross and Blue Shield of North Carolina. You're well aware of how these plans work. The 80-20 plan, the plan pays for about 80% of the cost, and you have a 20% cost share. With the Blue Cross Blue Shield 70-30 plan, again, the plan pays about 70%, and then you have a 30% cost share. Now, the plan utilizes Blue Cross Blue Shield as a third-party administrator. We call them a TPA for short. And they provide us with more than just claim processing. They provide us with a customer service department to answer benefit questions or help you understand how your claim was processed. They have utilization management. They do prior authorizations, and they process claims for us. But the claims themselves are actually paid by the state health plan. And we do that through a pool of dollars that is allotted to us through the North Carolina General Assembly, the taxpayer dollars, and the dependent premiums that people pay for any covered dependents that they have on their plan. It's that pool of dollars that is used to pay every single medical claim that is submitted. So the state health plan is at full risk for those medical claims. Then we have a pharmacy benefits manager. We call it a PBM for short, and that is CVS Caremark. They provide us with a network of pharmacies that you can go to, not just CVS pharmacies. You can go to Walgreens and Harris Teeters and Walmarts and independent pharmacies, and they are filling the prescriptions. But again, it is the state health plan that is paying for the cost of those prescriptions, less your copays. So again, we're at full risk for the pharmacy claims also. Now, when you become Medicare eligible and you're retired, your health plan options change. The 80-20 plan with Blue Cross Blue Shield would no longer be an option. For the current plan year, anyone who is retired and Medicare eligible has the option of the United Healthcare Group Medicare Advantage Base Plan, the United Healthcare Group Medicare Advantage Enhanced Plan, or the 70-30 plan administered by Blue Cross and Blue Shield of North Carolina. Now, the Medicare Advantage Base Plan is a premium-free option for the qualified retiree. And I'll explain what a qualified retiree is in just a moment. You do pay the full dependent premium on the Medicare Advantage Base Plan, and for the 2020 plan year, if you were going to cover a Medicare eligible spouse, you would pay $112 per month. For the United Healthcare Group Medicare Advantage Enhanced Plan, that does have a retiree premium. So the qualified retiree on the enhanced plan would pay $74 per month. If you were also going to cover a Medicare eligible spouse, you would pay an additional $182 on top of the $74. So your total premium would be $256. The 70-30 plan is a premium-free option for the qualified retiree. You won't pay anything for yourself. However, you will pay the full premium if you were going to cover a Medicare eligible spouse. That premium would be $425 per month. So there's a big difference there, and I'll explain that in just a moment. Before we move to the next slide, the other thing I want to mention is that no matter which one of these plans you choose, you are a state health plan member. You have to remember that these are all group plan options under the umbrella of the state health plan. A lot of people think if they aren't on the Blue Cross plan that they have given up the state health plan coverage, but that's not correct. These are group plan options under the umbrella of the state health plan. You are a state health plan member no matter which plan you choose. Also, all of the plans include prescription drug coverage. You do not have to go out and get your own prescription plan if you are covered on any of these plans. The Medicare Advantage plans with United include a Medicare Part D drug plan. The 70/30 plan includes the traditional pharmacy benefit. It is not a Part D drug plan. However, it is considered to be creditable coverage by the Centers for Medicare and Medicaid. What that means is that Medicare thinks the prescription drug plan under the 70/30 plan is just as good as a Part D drug plan. And that means you would not be penalized for not having enrolled in a Part D drug plan on your own. So no matter which one of these options you go with, you will have drug coverage. As a reminder, as I mentioned at the top of the presentation, the United Healthcare Group Medicare Advantage plans are offered through the end of this plan year. However, starting in 2021, Humana will be the carrier for the Medicare Advantage base plan and the enhanced plan. So with the Medicare Advantage plan, just so you have an understanding of how it works, United Healthcare and next year Humana is considered to be a Medicare Advantage organization. And what that means is they have contracted with the Centers for Medicare and Medicaid to manage your Medicare Part A and Part B benefits. You can't be in a Medicare Advantage plan unless you have both Medicare Part A and Part B. But what Medicare does is they're paying a fee to United or to Humana, and they're saying, here, you manage John Smith's Part A and Part B benefits. Now, the state health plan has contracted with United and next year with Humana to provide us with group Medicare Advantage plan options. So we're paying them a fee to have these group options for just our state retirees. Nobody who is not a state retiree would be able to enroll in these group plans. But it is the Medicare Advantage organization who assumes the full risk of paying every medical and pharmacy claim that is submitted. And that is why you see such a big difference in the premiums to cover a dependent spouse. Where on the Blue Cross plan, the state health plan has all of the risk for claims payment. On the Medicare Advantage plans, it is the Medicare Advantage organization who assumes the risk of claims payment for medical and pharmacy services. So let's try and break down Medicare so it doesn't seem quite so overwhelming. When you turn 65, you become eligible for what's known as Original Medicare. There's Medicare Part A, which is inpatient hospitalization. You don't pay anything for Medicare Part A. All of those taxes that you paid out of your paycheck every month, that's what goes to pay for Medicare Part A. Medicare Part B is the medical portion of Original Medicare. It covers the doctor's bills. It covers any outpatient services you would have. If you were to have outpatient surgery, that would fall under Medicare Part B. You will pay a premium for Medicare Part B. We will talk about that in just a moment. That monthly premium that you pay for Medicare Part B goes directly to the federal government. It does not come to the state health plan or the state of North Carolina. Now, Original Medicare typically picks up about 80% of your medical costs. And in general, people who don't have state health plan coverage would say, well, gosh, I need to do something about that other 20%. And they might consider option one and sign up for a Medicare supplement or a Medigap plan, if you've heard those terms before. Those types of policies that you buy from individual carriers or through agents, those are designed to work with Original Medicare only. They will not coordinate with a Medicare Advantage plan. People will then also sign up possibly for a Medicare Part D drug plan when they get a Medigap plan, because they need something to take care of their prescription costs. The other option people may consider is signing up for a Medicare Advantage plan like the ones you have with the state health plan. And again, a Medicare Advantage plan, sometimes referred to as a Part C plan, combines your A and B benefits under one all-encompassing plan. Some plans, Medicare Advantage plans, include a Part D drug plan and some don't. Again, those offered by the state health plan do include a Medicare Part D drug plan. Medicare Advantage plans can also offer some additional benefits that you don't get through original Medicare or a supplement. Wellness programs, fitness programs, disease and case management services. So there are usually some extra bells and whistles, as we'll go into more detail as we get further into the presentation, when you are enrolled in a Medicare Advantage plan. Now, as I said previously, you must have Medicare Part A and Part B to be enrolled into a Medicare Advantage plan. Remember, Medicare is paying that Medicare Advantage organization to manage your Medicare A and B benefits. Again, Part A is typically premium free. If you've worked at least 10 years in your lifetime and paid those FICA taxes, you're not going to pay for Medicare Part A. But Medicare Part B does have a monthly premium for anyone who is aging into Medicare during the 2020 plan year. The monthly premium will be $144.60 per month. That will go directly to the federal government. Now, the Part B premium can even go as high as $491.60 per month. It has to do with your income, and I'm going to talk about that in just a moment. But again, you have to have Part A and Part B to be in a Medicare Advantage plan. If you don't have it, then it will not be an option for you to enroll in a Medicare Advantage plan. The 70/30 plan is considered to be traditional insurance. It does not require your enrollment into Medicare to be enrolled in the 70/30 plan. However, the state health plan is required under North Carolina general statute to act as a secondary insurance to Medicare. That means if you do not have Medicare Part A and Part B in place, then you will become responsible for the charges that would have been paid by Medicare. So you can see, really, no matter which plan option you choose as a state health plan, Medicare eligible retiree, you will need to have both Medicare Part A and Part B. There is no getting around paying the Part B premium to the federal government. Now, you can enroll in Medicare as early as 90 days or 3 months before your 65th birthday month. This allows your Medicare to become effective the first day of your birthday month, which is when you are actually Medicare eligible. If you're born on, say, July 15th, you are considered Medicare eligible on July 1st. There is only one exception to that rule, and that is if you were born on the first day of the month. If you were born on, say, July 1st, you would actually be considered Medicare eligible on June 1st. So that's the only exception to the rule. So if you elected to start receiving your Social Security benefits, if you're already drawing Social Security, signing up for Medicare is very easy because Social Security takes care of it for you. All you have to do is wait for your little red, white, and blue Medicare card to come in the mail. The Social Security Administration will begin deducting the Medicare Part B premium from your Social Security check. You typically will receive that card anywhere from 60 to 120 days before you turn 65. If you have not received the card at least 60 days before your 65th birthday month, we suggest you contact the Social Security Administration and find out where your card is. If you are not already drawing Social Security, then it is up to you to take action and enroll in Medicare. You can go by any local Social Security office to sign up. If you are considering that method, I would suggest that you call and make an appointment. You can also call Social Security at the number listed here, 1-800-772-1213, anytime between 7 in the morning and 7 p.m. You can also go online to sign up for Medicare A and B. Just go to their website, socialsecurity.gov. I think ssa.gov will also get you there. So several options you can utilize to sign up for Medicare. Now, you have what's known when you're becoming Medicare eligible as an initial enrollment period. It's called an IEP, and it's a period of time which surrounds your 65th birthday month. It's 7 months long. It includes the 3 months prior to your 65th birthday month, your 65th birthday month, and then the following 3 months after your birthday month. Now, if you want to have your Medicare in place as of your birthday month, then you need to sign up for Medicare during the 3 months before your birthday month. If you do that, then your Medicare Part A and Part B will be in place as of the first of the month in which your 65th birthday occurs. But if you delay your enrollment into Medicare, then it can delay your Medicare effective date. Now, this rule is a Medicare rule. It is not the state of North Carolina or the state health plan. Only the federal government could come up with this. So if you wait and say until the month you turn 65 to sign up for Medicare, then your Medicare effective date will not be until the month after. You would delay it by 1 month. If you waited until the month after you turned 65 to sign up for Medicare, now you have delayed your Medicare effective date by 2 months. If you wait until 2 months or even 3 months after your 65th birthday month, now you have delayed your Medicare effective date by 3 months. And remember, if you don't have your Medicare in place, it's going to limit your plan options. You would end up in the 70-30 plan, and remember, without Medicare in place, we're required to act as a secondary insurance. So if you received any medical services and you didn't have that Medicare in place, you're going to be responsible for what would have been paid by Medicare. So it can be very costly if you delay. Now, if you have worked beyond age 65, you probably delayed electing Medicare Part B, which was a smart thing to do. As long as you are a full-time employee for the state of North Carolina or the public school systems or community colleges or universities, then the state health plan is your primary coverage. Medicare is secondary to the state health plan. So there's no sense in paying that Medicare Part B premium as long as you're full-time. But when you do make the decision to retire, there are a couple forms you're going to have to get filled out. The first one is your application for enrollment into Medicare Part B. That form is listed here. It's Form CMS 40B-E. You're going to fill that form out, and then there's a second form that you're going to have filled out by your Human Resources Office. It is CMS L564E. That is a request for employment information. Your Human Resources Office or your health benefits representative with your employing agency needs to complete that. What they are doing is verifying that you were a full-time employee with employer group coverage, which is why you delayed your enrollment into Medicare Part B. By having this form completed, it makes you exempt from any type of late enrollment penalty that you would get for not signing up for Part B when you first turn 65. The main thing is you want to make sure that you have your Medicare Part B in place as of your official retirement date. That's very, very important. Your Medicare Part B must be in place as of your official retirement date. Now, these forms are available on the Social Security website. You can download them. You can call Social Security. They will mail them to you. I have been told that some Human Resources Office have these forms on hand. You might want to check with them, but if they don't, you can go to the Social Security website. Another important tip here is that when you do complete your Medicare Part B application, the one you complete, go by your Human Resources Office and pick up the completed form verifying your employment information. You will want to attach these forms together. Under no circumstances should you send these forms in separately. If they go in separately, they're never going to meet up again, and you will probably have to start the whole process over again. So you want to make sure that you either hand carry them to your local Social Security office together, or you can mail them in together, but do not send them in separately. So let's talk about what can affect those Medicare Part B premiums. There's something known as IRMA for short, stands for Income Related Monthly Adjustment Amount. And people who may have a higher adjusted gross income will have a higher Part B premium. But IRMA also affects people who are enrolled in Medicare Part D drug plans, which is why we want to make sure you're aware of this, because you have to remember, if you enroll in one of the Medicare Advantage plans, they include a Part D drug plan with the state. So if you do have a higher income, not only would you have a higher Part B premium out of your Social Security, but you could also see an additional charge for Medicare Part D. Now, the IRS will look at your tax returns from 2 years ago, and they're going to be looking at your modified adjusted gross income. If you file your taxes as an individual and your modified adjusted gross income was greater than $87,000 a year, or if you're married and filing jointly and your modified adjusted gross income was over $174,000 a year, you're going to be paying a higher Part B premium. And if you are in one of the Medicare Advantage plans, you will see an additional charge for Medicare Part D. Anyone enrolling in Medicare this year, the IRS would be looking at your tax returns from 2018. The IRS will look at your tax returns from 2 years ago on an annual basis. So your premium could go up or down depending on what your modified adjusted gross income was 2 years ago. As far as the Part D cost goes that you could experience if you have a higher income, it can range anywhere from $12.20 a month on up to $76.40 per month. So it's something you want to take into consideration. Most state health plan retirees are not affected by IRMA, but we'd like to make sure you're aware, because if you had, say, maybe an inheritance, or you sold some property, or maybe your spouse works in the private sector and they got a bonus, you know, anything that could have affected your income that year could have an effect on your Medicare premiums. So let's talk about your contribution status. This has to do with how I mentioned a qualified retiree earlier in the presentation. That whether you're a qualified retiree or not affects what your contribution may be for your state health plan coverage. If you were hired prior to October 1, 2006, and you have at least 5 years of service with the state, then you are eligible for state health plan coverage as a retiree, and you're either going to have a $0 monthly premium, or you may have a small contribution depending on the plan you choose. If you were Medicare eligible and you chose the enhanced plan, you would have a premium, monthly premium for that plan. If you were not Medicare eligible when you retired and you chose the 80/20 plan, you'd have a small premium for that coverage. But for the most part, you're going to have a $0 premium or pay very little. Now, for those of you who were hired on or after October 1, 2006, there was a change in legislation. If you have at least 5 years of service but less than 10, then you are eligible for state health plan coverage as a retiree. However, you are going to pay 100% of what the state contribution would have been to cover you. So you're going to be responsible for the full amount. If you were hired on or after October 1, 2006, and you have at least 10 years of service but less than 20, then you are also eligible for state health plan coverage as a retiree. You will be considered 50% contributory, meaning your monthly premium will be 50% of what the state contribution would have been to cover you had you been hired prior to October 1, 2006. We don't have anyone in this last category yet, but once someone who was hired on or after October 1, 2006 has at least 20 years of service, then they'll be like the folks who were hired prior to October 1. They will pay either nothing or a small contribution depending on what their plan selection is as a retiree. The reason I want to make sure you're very aware of this is that when you retire, if you are eligible for state health plan coverage as a retiree, regardless of your contribution status, you will be auto-enrolled into state health plan coverage. So if you don't want state health plan coverage because you're going to be contributory, either fully or 50% contributory, then you need to make sure you opt out of coverage. You can do that one of two ways. You can either call the Eligibility and Enrollment Support Center at 855-859-0966, or you can go online, log into your Orbit account, and click on the link for eBenefits and opt out of coverage online. There is no paper form with a box on it that says no that you're going to check. A lot of people will try to tell me, I filled out the paperwork and marked that I didn't want state health plan. There is no such form. You can only call or go online if you don't want state health plan coverage. Another thing I hear a lot from retirees is they say they told their human resources representative or their health benefits representative with their agency that they didn't want state health plan coverage. Your health benefits representative or your human resources office cannot opt you out of coverage. You have to do it yourself, and once again, you do it by calling the Eligibility and Enrollment Support Center or logging into Orbit and clicking on the link for eBenefits to opt out online. So some important information about when your benefits are effective with the state retirement system. When you retire, you are actually covered under the employing agency that you retired from for your first month of retirement. So in this example, let's say you retired on January 1st, then you would be covered by that agency for the month of January. The state retirement system would not pick up your benefits until the first of the month following your retirement date. So in this example, it would be February 1st. If you are Medicare eligible as of your retirement date, maybe you're on the 80-20 plan as an active employee, you're going to stay on the 80-20 plan for that first month under the employing agency. However, because you are Medicare eligible and you're no longer considered to be an active employee, Medicare will now be primary to that 80-20 plan. If you do not have your Medicare in place as of your retirement date and you receive medical services during that first month of retirement, you will then become responsible for the charges that would have been paid by Medicare Part B. So it's very important, folks. I have seen retirees who thought they would save that premium for the first month of their retirement since they were still under the employing agency. One person actually had outpatient surgery to the tune of $30,000. and they had to pay the portion that would have been covered by Medicare, which was about 80% of that bill. So you can see you've got to have that Medicare Part B in place as of your retirement date. So if you're under 65 and retiring, we suggest that you talk to your HR office about your decision. Let them know when you want to have your official retirement date. You can start the process as early as 120 days prior to your desired retirement date. If you submit an application any earlier than that, retirement system will not take action. It'll end up in the trash, and you'll have to start the process all over again when you hit that 120-day mark. So keep that in mind. Once the retirement system approves your application, they will notify the Eligibility and Enrollment Support Center of your eligibility for coverage, and you will be auto-enrolled into the state health plan. You will stay on the same plan that you had as an active employee. So if you're retiring at 62 and you're on the 80-20 plan, you're going to automatically get enrolled under the retirement system on the 80-20 plan. If you're covering any dependents as an active employee, they will also be auto-enrolled under the retirement system. So if you do want to make changes, retirement, when you're going through this process, that is your opportunity to do so. We even auto-enroll people into the health plan even if they didn't have coverage as an active employee with the state health plan. Maybe as an active employee, you opted out of coverage because you were on your spouse's plan, maybe, who was working in the private sector. But if you have enough years of service at the time you retire, again, you are auto-enrolled into the health plan. An early retiree or under 65, if they didn't have coverage as an active employee, then you would actually be auto-enrolled into the 70-30 plan. So again, if you don't want coverage, it's up to you to opt out. If you're eligible and you don't want it, you've got to opt out, either by calling the Eligibility and Enrollment Support Center or going online, logging into your Orbit account, and clicking on the link for eBenefits. A lot of people will ask, why do you auto-enroll people when they retire? And we didn't used to. Several years ago, when people went through the retirement process, they had to actually sign up for state health plan coverage when they retired. But people thought their benefits kind of magically transferred over to the retirement system from the employing agency, and then 6 months down the road, they might go to the doctor or urgent care and find out they had no health insurance. So that is why we auto-enroll you. And again, if you don't want it because maybe you're going to be contributory for the coverage, you've got to opt out. All right, so now what I'm going to do is, actually Roberta has come in. I'm going to ask her to step in before I start to lose my voice, and she's going to do the rest of the presentation, and then at the end we're going to open it up for questions. So remember, keep typing questions into your question box as you have them. We'll be able to pull them all up at the end.
Good morning, everyone. This is Roberta Hamby, and I'm going to pick up where Jane left off relative to those of you who are still actively working and you're approaching age 65, but you're planning to continue to work beyond age 65. For those members, the plan will actually mail you a letter approximately 30 to 60 days before your 65th birthday month, advising you of your Medicare eligibility. This letter just simply confirms that you will become Medicare eligible at the age of 65. We will recommend that you enroll in Medicare Part A. Now, that is the hospital insurance, and if you recall, Jane mentioned earlier in the presentation, that is typically premium free for most individuals if you've worked 10 years or more and paid FICA taxes. We will recommend, though, that you delay enrollment into Medicare Part B, as in boy. That is the medical insurance. And we ask you to do that primarily due to the fact that Medicare Part B would be secondary to the state health plan. As long as you are continuing to work for the state, your state health plan coverage will be your primary coverage, and Medicare would be secondary. Even if you work to your 75 or 80, that Medicare Part B coverage may be delayed. And once you then decide to retire, though, it is important that you have that Medicare Part B in place and ready to become effective as of your retirement date. Now, you will not receive a separate notification from the state health plan reminding you to enroll in Medicare Part B, but it is addressed throughout many of the retirement materials as well as information on the state health plan site. But it will be important to make sure you enroll in Medicare Part B to become effective as of your retirement date. Now, if you are planning to retire and you are 65 or older, as we've mentioned earlier, you may begin your online retirement process through the Orbit system, or you can continue to use the paper retirement application. You would want to submit this approximately 120 days before your anticipated retirement date. You should not submit it any earlier than 120 days. As Jane just mentioned, it will be set aside, it will not be looked at again, and you would have to start all over from scratch. As I just stated, it is important to have your Medicare coverage in place as of your anticipated retirement date. Now, if you are going to continue to cover any non-Medicare dependents, they will be automatically enrolled into the health plan they were covered as an active dependent. And as we've mentioned several times, that you do have the ability or the option to opt out of this retiree state health plan coverage during the retirement process. And you must do that either by calling the Eligibility and Enrollment Support Center at 855-859-0966 or go online through the e-benefits system. Advising your personnel officer, your health benefit representative that you do not want retiree health coverage is not opting out of the state health plan. They cannot take that action on your behalf. You have to take the action. So either by calling Eligibility and Enrollment Support Center or going online. Now, this slide looks very similar to one that Jane went over earlier in the presentation, and we wanted to give you some additional information for you to take into consideration. If you are retiring at the age of 65 and you're planning to retire shortly after turning 65, remember, Medicare has to be in place and effective as of your retirement date. And you may enroll in Medicare, during the 3 months before your 65th birthday month, the month of your 65th birthday, or during the last 3 months or the following 3 months after your 65th birthday month. But if you enroll in Medicare during the month you turn 65 or anytime during the 3 months following your 65th birthday month, then it is possible you could have a situation where you are going to be prevented from having your Medicare coverage in place as of your retirement date. Here's an example of a situation that came up this past year or so. Someone turned 65 in April, and they were planning to retire effective August 1st. So if they were signing up for Medicare during the month of April, then it would become effective May 1st. If they enroll during the month of May, then it's going to become effective July 1st. If they enroll during the month of June, it's going to become effective September 1st. And if they enroll during that last month of the initial enrollment period, the month of July, their coverage is going to become effective October 1st. As you see, they were unable to have it effective August 1st. So this is something to take into consideration if you're planning to retire shortly after turning 65. Are you still going to be within that initial enrollment period? If so, you may want to make some adjustments to your retirement effective date. Now, for those members who are retiring and they are 65 or older and going to be Medicare eligible, if you have submitted your retirement paperwork or started your online retirement process and everything is processed and approved at least 60 days prior to the effective date of your retiree health coverage, then you will be automatically enrolled into the United Healthcare Medicare Advantage base plan. Now you will receive notification of this and be given an opportunity to elect any of the other Medicare primary options up until 30 days before the retiree benefit effective date. If you make no other election, then the auto enrollment will be completed during the 30 days before the retiree benefit effective date to begin the coverage. So an example here, the state health plan benefit effective date is the first of the month following the retirement effective date. So if the retirement date is January 1st, the state health plan effective date for retiree coverage will be February 1st. For those of you who may not be able to submit a timely retirement request, and this does occur sometimes when someone has, family situations arise, or maybe your own situation may cause you to decide to retire sooner than what you anticipated. Now, if this happens and your retirement paperwork is finalized less than 60 days prior to the effective date of your retiree health coverage, then you would be auto-enrolled into the 70/30 PPO plan. Now, the reason for this is due to the fact that federal guidelines requires us, as well as United Healthcare, to provide notification of 60 days or more if we are auto-enrolling you into a Medicare Advantage plan. So in these type of situations, we would not have sufficient time or leeway in order to provide that type of notification. So this is the reason for the enrollment into the 70/30. Now, this does not mean you cannot get into a Medicare Advantage plan. It simply means that you're not auto-enrolled into it. Now, you will be able to elect a Medicare Advantage plan up until the day before your retiree health coverage benefit effective date. For those of you who are covering family members, please keep in mind that Medicare primary family members will stay together. So if you are covering a spouse when you get ready to retire, and you and the spouse both will be Medicare eligible, then you would follow into the same plan option. Now, if your spouse or dependent children are not Medicare eligible, then they will have the same options as active employees that are non-Medicare members, 70/30 and 80/20 PPO plans. But remember, if you're covering them under your active coverage, they will roll over into the same plan option that they currently have as an active dependent. Now, when one member of the family unit is Medicare eligible, one or more are Medicare eligible and others are not, we consider this to be a split family situation. And in these situations, the total premium, though, the total family premium will come out of your state pension. If your state pension is not sufficient to cover the premium that is to be charged to you for the coverage, then you would move over to a direct bill status. For those of you who are already in the retirement system, but you are becoming 65, we classify you as age-ins. That's what we call you around the office. You're an age-in, you're aging into Medicare. You will automatically be enrolled into a Medicare Advantage plan. You will receive notification of this enrollment approximately 80 to 90 days prior to your Medicare primary effective date. Now you will be auto-enrolled into the base plan, and you will be given the other enrollment options that are available, the Medicare Advantage Enhanced plan or the 70/30 PPO plan. Now you are able to elect any of the Medicare primary options up until 30 days before the effective date. Once that 30-day period starts prior to the effective date, you are locked into what is selected, either the default of the Medicare Advantage base plan or if you've made another selection. Now your Medicare primary effective date is the first of the month you turn 65. So if you turn 65 on April 15th, then your Medicare primary effective date will be April 1st. However, if you turn 65 on the first day of any month, let's say March 1st, then your Medicare primary effective date is the first of the month preceding. So someone who turns 65 on March 1st will become Medicare primary and Medicare eligible as of February 1st. Now we're going to take a look at Medicare Advantage plans and the 70/30 PPO plan. Jane and I have mentioned Medicare Advantage, the United Healthcare Group Medicare Advantage plans a number of times throughout the process today. And what is a Medicare Advantage plan? Well, it's considered to be a Medicare health plan choice. And this is a plan option that is offered under the state health plan's umbrella. Now, a Medicare health plan choice is either an individual or a group product. An individual product is one where you may go out and purchase one on the open market through an agent, as long as you have Medicare Part A and Medicare Part B in place. A group product is one that's offered to a particular group, and you have to be a member of that group or an eligible dependent to enroll in that plan. Now, group plans are generally more flexible because they've been customized or designed for that specific group. Most Medicare Advantage plans today do include Medicare prescription drug coverage, or otherwise known as Medicare Part D, as in drug. The plans under United Healthcare that we offer under our umbrella do include Medicare prescription drug coverage. Now, once you enroll into a Medicare Advantage plan, remember that Medicare Advantage plan is managing your Medicare Part A and Medicare Part B benefits on behalf of the federal government. Now, you're still considered to be in the Medicare program. However, you do not have original Medicare. When you have original Medicare, the federal government is managing your Medicare Part A and Medicare Part B benefits. When you're in that Medicare Advantage plan, the Medicare Advantage plan carrier, such as United Healthcare, is managing your Medicare Part A and Part B benefits. But due to the fact that you're still considered to be in the Medicare program, you do retain all the same rights and protections as someone who is under original Medicare. Furthermore, a Medicare Advantage plan must cover all the same services that original Medicare covers. They cannot pick and choose which plan or which benefits they want to offer out of the original Medicare benefits. Now, you do have to have both Medicare Part A and Medicare Part B in place in order to be enrolled in a Medicare Advantage plan. That means you have to continue to pay that Medicare Part B premium. That premium is paid to the federal government by the member. Generally, it will come from your Social Security benefits if you are receiving them, or if you are not receiving Social Security benefits yet, you've delayed them, then you will receive a direct bill from the federal government. Now, it is possible to set up to pay those premiums on a monthly basis to the federal government, but I think that opportunity arises after you've received your first quarterly billing statement from the federal government. With the United Healthcare plans, these are considered to be National Preferred Provider Organizations, or PPO plans. With these plans, you have access to a nationwide network of providers. Now, remember, you do not have to have a referral to see a provider. These also provide you with additional benefits at a lower cost and includes an open network, or what is also known as a passive network. This means that your co-payments or co-insurance remain the same regardless of who you see, whether it's in-network or out-of-network. But it is important to know that out-of-network providers must participate with Medicare and agree to accept and file on your behalf with United Healthcare. Excuse me. With a Medicare Advantage plan, you do have the simplicity and the predictability of a Medicare Advantage plan. The simplicity is the fact that you have only one ID card for medical and for prescription drugs. So you would only use the United Healthcare ID card when seeking medical services or prescription drug services. Your red, white, and blue Medicare card, you simply want to tuck that away, keep it safe and sound. That card signifies original Medicare. And remember, you do not have original Medicare once you enroll in a Medicare Advantage plan, but you are still considered to be in the Medicare program. The predictability of a Medicare Advantage plan is the fact that these are co-payment driven plans, meaning that the majority of covered services, whether they're medical or pharmacy, have an established co-payment. This allows you to know what your out-of-pocket cost will be upfront in most situations. Now, also with the United Healthcare plans, they provide some extra services that are not typically found under original Medicare and possibly under the 70/30 plan. The wellness program of Silver Sneakers, this is a program that's available under the base and the enhanced plan. And actually all of these are available under the base and enhanced plans. You have disease and case management, nurse helpline 24/7. You have routine eye and hearing exams, as well as a hearing aid benefit and a hearing aid discount program. Often as we're traveling around the state, we are asked about whether or not the United Healthcare plans will work with other insurance. So we want to just take a couple slides and talk about other insurance. So with the United Healthcare plans, generally you do not have a need for additional coverage. And in fact, if you enroll in another Medicare health plan, it could cause you to be disenrolled from your state health plan, United Healthcare Medicare Advantage plan. This means if you enroll in a Medicare Advantage plan or a Medicare prescription drug plan, then it will cause you to be disenrolled from the state health plan's coverage under the United Healthcare plan. Now, if that does happen, we will automatically enroll you into the 70/30 plan because it is not a Medicare health plan. Also, please keep in mind that the Medicare Advantage plans do not work with a Medicare supplement, or what is also known as a Medigap plan. Now, a Medigap or Medicare supplement plan, they're identified with an alpha character and offered by private companies. You'll hear advertisements on TV or receive advertisements in your mailbox for a plan G or a plan A and M and N. It goes clear up through N right now. These plans only coordinate with Original Medicare. They will not work with a Medicare Advantage plan. We have a number of our retirees who also are retired military and are covered by TRICARE. Once they become age 65 or older, then their TRICARE will convert over to TRICARE for Life. And TRICARE for Life generally wraps around Original Medicare and picks up what Original Medicare has left as the member's responsibility. These plans, TRICARE for Life, will work with Medicare Advantage plans. There is nothing that would prohibit you from enrolling into a Medicare Advantage plan if you have TRICARE for Life. Typically how it would work is the Medicare Advantage plan is going to be the primary coverage. TRICARE for Life will cover the copayment for services that are also covered by TRICARE for Life. You cannot use Medicare or a Medicare Advantage plan in a military treatment facility, such as a VA hospital. Now, we also have a number of retirees who have other insurance from other retiree health plans, such as you've worked in another state or possibly in the private sector and you've retired with retiree health coverage from them, as well as from the state of North Carolina. It is very important to check with them to ensure that enrollment into one of the group Medicare Advantage plans will not disrupt coverage with them. Many states, as well as private sector employers, are now offering group Medicare Advantage plans or group Medicare prescription drug coverage to their retirees. Remember, you cannot be in multiple Medicare health plans at the same time. And with some plans, other retiree health plans, if you are bumped out of their coverage, you cannot get back into the retiree health plan, unlike with the state health plan. With the state health plan, you can leave the state health plan and then come back into the state health plan during any open enrollment period for the following plan year, or if you incur a qualifying life event. Now, also, some of our members have some individual coverages out there, such as cancer, long-term care, hospital indemnity, dental, vision. These type of insurance products will not have any effect on your eligibility or coverage under a Medicare Advantage plan. Now, just briefly relative to the 70/30 PPO plan, this is still an option for those of you who are Medicare eligible. And under the retirement system, the 70/30 plan is administered by Blue Cross and Blue Shield of North Carolina, also known as Blue Cross NC. It is supported by the Blue Cross Blue Options and the North Carolina State Health Plans network of providers. This plan, the 70/30, does include traditional prescription drug coverage. It is not Medicare prescription drug coverage. It is not Part D, but it is considered to be creditable drug coverage, meaning that it is as good as or better than a standard Medicare prescription drug plan. When you elect to go with the 70/30 plan instead of one of the group Medicare Advantage plans, Original Medicare will be your primary insurance. The 70/30 plan is going to be considered secondary insurance. It is not supplemental insurance. It is not going to pick up and pay 100% of what Medicare has left as your responsibility. Now, in this type of situation, you would use 2 ID cards. You would have to show your red, white, and blue Medicare card and your 70/30 card when you're seeking medical services. If you're trying to pick up prescriptions at your pharmacy, you would need to only show your ID for the Blue Cross and Blue Shield 70/30 plan. Now, co-payments, co-insurance, and deductible requirements under the 70/30 still have to be met. Even though Medicare is primary, those requirements are still needed. Medical co-payments do not apply to the deductible, but they do apply to the maximum out-of-pocket limit under the 70/30 plan. Excuse me. We're going to go over these next few slides very briefly. This is a comparison chart. It is also available on the State Health Plan's website. And relative to the United Healthcare Base Plan and the United Healthcare Enhanced Plan, as we've stated, you can use in or out of network providers. It is important, though, if you see someone out of network, to make sure that they do accept Medicare and will accept your insurance coverage. There is a maximum out-of-pocket limit of $4,000 for the base, $3,300 for the enhanced. As you see, it is $700 difference for the maximum out-of-pocket limit, and this is for medical services. All co-payments for medical services will be applied to reaching that maximum out-of-pocket limit. For a primary care doctor and for a specialist visit, as you can see, there's only a $5 difference between the base and the enhanced plan. For urgent care, there's a $10 difference, $50 to $40. And the same way on the hospitalization, there's only a $10 difference. On the 70/30 plan, remember, it's very important to try to stay in network when you are using the 70/30 in lieu of going with the United Healthcare plans. You do have an annual out-of-pocket limit of $5,900. This is a combined medical and pharmacy out-of-pocket limit. The annual deductible, again, is $1,500, and this is a combined medical and pharmacy annual deductible. There is no deductible under the United Healthcare plans. Please remember, Medicare is primary when you have the 70/30. So the co-payments that are being reflected here is the maximum you would pay. If Medicare has paid for your specialist visit and left only $33 as your 20% responsibility, and the co-payment is $94 under the 70/30, you would be responsible for that $33. Lab services is one of the most important things we want to point out on this slide. Under the United Healthcare Base and Enhanced Plan, there are co-payments for lab services. In most situations, if you go to your primary care doctor and they perform lab work and it is sent out to another lab to be processed, you will end up having two co-payments, a co-payment for the office visit as well as a co-payment for the lab. Under the 70/30, if the lab work is performed during your primary care or specialist office visit, typically there will not be an additional fee as long as an in-network lab is used. In regards to pharmacy benefits under the United Healthcare plans, there is a maximum out-of-pocket limit that is separate from the medical maximum out-of-pocket limit. For the United Healthcare plan, it's $2,500, whether it's the base or the enhanced. You have a $0 deductible. Please note that Tier 1 and Tier 4 under the United Healthcare plans have the same co-payment setup. Under the Tier 2 and Tier 3, there are slight differences between the base and the enhanced. United Healthcare formulary is the same, whether it's the base or the enhanced plan, but the formulary does differ somewhat from the formulary used under the 70/30 plan. As you can see, the formulary is broken into 4 tiers under the United Healthcare plan. Under the 70/30, there are 6 tiers or 6 levels. Under the 70/30 plan, you have a combined medical and pharmacy maximum out-of-pocket limit of $5,900, deductible of $1,500. So some important information we want to briefly go over for those of you who are under the retirement system as a result of disability, or perhaps you have a family member who is receiving Social Security disability benefits and you have them covered under the state health plan and you're under the retirement system. If you become Medicare eligible due to a disability, it's very important that you enroll in both Medicare Part A and Medicare Part B. You will not want to overlook accepting the Medicare Part B, even though you have to pay those premiums each month. We find that several people, or many people, actually fail to accept the offer to retroactively purchase Medicare Part B. There are times where Medicare is awarded retroactively because someone has had to fight for their Social Security disability benefits, and it may have taken them several years to finally get a positive judgment, and they're awarded Social Security disability benefits retroactively for several years. In that type of situation, the Medicare eligibility could also be made retroactive. If that occurs, you will want to make sure that Medicare Part A and Medicare Part B effective dates are matching and that you pay those back premiums for Medicare Part B. This is due to the fact the state health plan will become secondary to Medicare as of the Medicare eligibility date. We will reprocess all medical claims back to the Medicare eligibility date. We will reduce the claims by the amount that would have been paid under Medicare, and the remaining amount will be paid under the terms of the health benefit plan. As a result, if Medicare Part B is not taken retroactively, the member will be responsible for the amount that would have been paid by Medicare Part B. Reemployment in the state health plan. In order to comply with the Affordable Care Act, legislation was passed addressing non-permanent full-time employees a few years ago, and a newly eligible category was created. Employing units are responsible for determining the eligibility for this new category, and it does include non-permanent employees working at least 30 hours per week average. If the reemployed retiree qualifies for this new category, then the employing unit is required to cover them as an active employee. Now, you do not have to take coverage as an active employee. However, once you are deemed as being eligible under this new category, the reemployed retiree will be terminated from retiree group health coverage under the state retirement system. Qualifying life events will occur when that reemployment ceases, and the member would have 30 days to re-enroll under the state retirement system for state health plan coverage. If the enrollment occurs before the effective date, you would be able to re-enroll into a Medicare Advantage plan. Another important item is your address. It's very important to keep addresses current, whether you're actively working or under the retirement system. If you currently only have a P.O. box address on record with the state health plan, we will need to be provided with a physical address as well. United Healthcare is unable to process any enrollment with only a P.O. box number on file. This is due to federal regulations. Our systems are able to store multiple addresses. We can store the P.O. box number for mailing purposes and the physical address separately. So please update through Orbit or by calling the Eligibility Enrollment Support Center at 855-859-0966. So at this point, we will go ahead and move to the questions. If you will please be patient with us for a minute or two. We do need to pull the questions up. We're going to put you on mute at this time, but we will be back in just a minute or two.
Okay, everyone, this is Jane again. I'm back. We've got the questions pulled up and we'll go ahead and start answering them. One question we had, as you're aware, at the top of the presentation, I announced that Humana will be the new carrier for the Medicare Advantage plans in 2021. Someone wanted to know if there would be a plan comparison of the two. We don't have a plan comparison available yet. What I can tell you is that the Medicare Advantage base plan, all the copays and everything you saw listed on the base plan, that is going to remain the same. It's still going to be premium free, and the copays, everything there stays the same. The enhanced plan, they're still looking at it. We don't have that information right now. What I would encourage you to do is during the open enrollment period that will occur in October of this year for the 2021 plan year, we will send out decision guides, and there will be a plan comparison in there that shows you both the base and enhanced and the 70/30 plan. If you're a Medicare eligible retiree, that's the information it'll have in there, and you'll be able to look and see if the enhanced plan is something you want to consider for 2021. The base plan is going to stay the same, and that brings up one other important point, that if you are retiring this year, or if you're already retired and about to turn 65, remember, whatever plan choice you make for the remainder of this year is exactly that. It is for the remainder of this year. action could very likely be required during the open enrollment period for 2021. So don't just assume that whatever plan you have is just going to roll over. You need to make sure you look at that decision guide, find out what action is required, and take that action to make sure you have the plan that works best for you in 2021. Someone wants to know if you'll get a PDF file of this PowerPoint presentation, and yes, they do email that out to you. Usually goes out maybe an hour after the webinar has concluded.
It's also on our website.
And it is on our website also. And this session today was being recorded, so we do hope to have that posted also. We're just scrolling through here.
Someone asked whether or not the 70/30 PPO plan covers international travel. Well, yes, the 70/30 PPO plan will cover you on an emergency or non-emergency basis outside of the United States or its territories. As you may or may not know, Medicare does not provide coverage outside the United States. So the 70/30 would step up and act as your primary coverage. So you would still need to meet all the deductibles, co-payments, co-insurance requirements. Now, in regards to United Healthcare plans, the group Medicare Advantage plans, they too will cover you outside of the United States or its territories. However, they only cover for emergency situations. They do not cover for non-emergency situations. And once your emergency situation is no longer an emergency situation, it will no longer cover that. Okay.
Someone wanted to know what happens if their spouse is not 65 when they retire. So Roberta had talked about this briefly. When you retire, if you're Medicare eligible but your spouse is not, you would be what we call a split family. Sounds very ominous, but it might mean that you go on the Medicare Advantage base plan, but since your spouse is not yet eligible for Medicare, they might stay on the 80/20 plan or the 70/30 plan. A split family just simply means that one of you is Medicare eligible and one of you is not. Now, when your spouse does become Medicare eligible, then they would be automatically moved on to the same plan that you have. So again, Medicare eligible families stay together, but if you have dependents who are not Medicare eligible, then they just stay on either the 80/20 or 70/30 plan.
On the other note, another note relative to that topic though, if you are an active employee and you're going to continue to be working and you are covering a spouse who is soon to become Medicare eligible because they're aging into Medicare, or maybe they're being awarded Medicare due to a disability, you may want to consider bumping that spouse off of the state health plan. Their eligibility for Medicare is a qualifying life event and allows you to make changes by removing them from the state health plan. You would want the spouse to enroll in Medicare Part A and B and look at individual products that are out there. This can save you significant premium. So from a financial standpoint, it's something you may want to look at. You can get an individual Medicare supplement or Medigap plan when you first turn 65 at a very reasonable cost, around $100, $110 per month. And then you can get a Medicare Part D plan for a small amount, and then take in consideration you'll have your Part B premium. But you could save yourself several $100s each month. So this is something to keep in mind if you're actively working, planning to continue to actively work, and your spouse is becoming Medicare eligible. Okay, let me see here. Okay, can you address this question at the end of the session? Missed the first part of the program, okay. I will be 65 in September 2020, but plan to work until December 2022. Please explain what I need to do concerning Medicare and how this. Okay, so if you're turning 65 in September 2020, but you're planning to work for a couple more years, you would simply want to enroll in Medicare Part A and delay obtaining Medicare Part B. But once you decide to retire at the end of December 2022, then it will be important that you have Medicare Part B. You have to enroll in that separately. And that will require the completion of the two forms that Jane mentioned earlier in the presentation, the CMS 40B and the CMS L564E. You would want to complete those forms approximately 60 days before your retirement effective date.
So we have someone who asked about discussing cost estimates at some point when you have Medicare and the 70/30 plan, or you're on a Medicare Advantage plan. So that's really hard to do in regards to if you go with Blue Cross Blue Shield. Remember, all we can really say is it is based on the Medicare allowable amount, and that Medicare picks up about 80% of your cost. And then the 70/30 plan would apply the 70/30 benefits to the balance of the bill. So you could still have out-of-pocket costs. With the Medicare Advantage plans, remember those are copay based plans. So you're only going to have a copay for the applicable service being received. So you need to look at, where am I going to get my services done? If it's billed as outpatient hospital, you may have a $125 copay.
Right.
If it's
outpatient surgery, you'd have a $250 copayment.
Right.
Now that would include the surgeon's fee as well as the anesthesiologist's fee.
Right.
So it just depends on location of the service, what type of service is being provided. If you're inpatient at a hospital and you're in the hospital for, let's say, 4 days, $160 each day is their copayment. That includes any surgeons and physician fees, anesthesiologist fee. All of the services are built into that copayment.
Right. With the 70/30 plan acting as secondary insurance, again, depends on if it's a facility-based fee or an office visit fee. One example that I like to give people is if you have original Medicare and the 70/30 plan is secondary insurance, let's say you go see a specialist and Medicare is picking up the first 80% of the bill. Say there's, $100 left over after Medicare pays, that would cross over to Blue Cross Blue Shield, and they would look at it and they'd say, well, a specialist copay on the 70/30 plan, a member copay, is $94, and there's $100 left on this bill. So Blue Cross would only pay $6 and you'd pay $94. If the amount that's left over after Medicare pays is less than what a member copay is, Blue Cross won't pay anything, because they would say, well, this balance is less than what the member's responsible for, so you end up paying the balance after Medicare. Remember, the 70/30 plan is not a Medigap policy. It's not meant to cover whatever Medicare doesn't pay. It's only a secondary insurance.
Someone indicates that their birthday is in October 31st, 55. What is the earliest date they could enroll into Medicare A and Medicare Part B? That would be July. Anytime after July 1st, they would be able to enroll. Okay, hold on, we're looking for some more questions.
Oh, that's not,
okay. Hold on here, we've got.
The presentation, again, is available on the State Health Plan website, and it will also be emailed out.
Someone asked, in what case would you want to opt out of the state health plan coverage? If someone has multiple retiree health coverages, that could be a reason, or perhaps they have this Medicare and they have TRICARE for life. We have seen members opt out of the state health plan in that type of situation. Sometimes having too much insurance can be complicating.
Yeah, I mean, anyone who's going to be fully contributory,
Right.
a lot of times if you're Medicare eligible, you know, fully contributory on the state health plan, depending on what plan you choose, if you went with the 70-30 plan, you're looking at, you know, over $400 to be on the 70-30 plan, and then paying the full premium for one of the Medicare Advantage plans. So, you know, sometimes people are like, no, I think I'm just going to go out and get my own coverage. So that's another reason.
Okay, someone says they're already receiving Social Security benefits. I understand that I'm automatically enrolled in Medicare, and that is correct. You should be automatically enrolled in Medicare Part A and Medicare Part B. They've talked to their local Social Security office, and they tell me that I need to still make an appointment. Why? I have no idea why. That would need to be a question directed to the Social Security office. But generally, you should be auto-enrolled into Medicare Part A and Medicare Part B.
So we've got someone who's asking in regards to both United Healthcare and Humana next year, if there are in-network providers only for a certain geographic area, or are they nationwide? So these will be nationwide, or are nationwide plans, and they are what we call passive PPOs, which means they don't have to be contracted with the carrier for you to be able to go to them. Your costs are going to remain the same whether or not that provider is contracted with United Healthcare, or next year whether or not they are contracted with Humana. Your copays remain the same no matter what. The question is, will the provider file the claim on your behalf directly to Humana? They will receive the same amount of money had they filed the claim directly to Medicare. The only difference is they're mailing that claim to a different address. And I can tell you, within North Carolina, doctors are very well aware that the state health plan offers these group Medicare Advantage plans and have been filing the claims on the members' behalf. And nationwide, I have not had any complaints about people who live out of state, and we have retirees in all 50 states that have been on these Medicare Advantage plans and have not had an issue.
Is a 70-30 plan wraparound coverage? No. As we indicated, it is secondary insurance. It is not going to pick up and pay 100% of what Medicare has left as your responsibility. You will still be required to meet co-payments, co-insurance, deductibles, and the maximum out-of-pocket limits will be in place, though.
Somebody wanted to know again how they pay for Part B when they're not receiving Social Security. Typically, when you sign up, Social Security would bill you on a quarterly basis. However, you can request to see if you can have that done on a monthly basis, maybe set up an automatic draft to pay for it on a monthly basis. Then once you do start to draw Social Security, you can make arrangements to have that automatically deducted from your Social Security.
Someone asked, if they decline initially, can I choose to enroll at a later date? If you are eligible for state health plan coverage as a retiree, and when you retire, you decide to decline that coverage, you would be able to come into the state health plan during any open enrollment period, or if you incur a qualifying life event.
Someone's asking How long in advance of retirement does a person who is already 65 need to sign up for Medicare Part B? You can do it like 60 days in advance.
Approximately 60 days in
60
advance.
days in advance of your desired retirement date. Sorry, there are a lot of duplicate questions, so if you hear a pause, we're just trying to weed out the repeat questions.
Okay, we've already covered that. Wait a minute. Okay, someone is living in England and Medicare does not pay for care overseas. Presumably, my best plan choice is not to sign up for Medicare Part B and to take the 70/30. Okay. Okay, with this, one, you would not be able to enroll in a Medicare Advantage plan if you are permanently living in England and you are unable to reside, have a permanent residence outside of the United States or its territories to enroll into a Medicare Advantage plan. So your only option would be to enroll in the 70/30. Now, in regards to delaying enrollment into Medicare Part B, I would double check with Social Security or with Medicare. You may incur a penalty for delaying enrollment into Medicare Part B.
So if you ever come back to the United States, that would...
Right, if you would come back to the United States and enroll and try to enroll in Medicare, you may incur a penalty, but that's something to check with Social Security or with Medicare relative to that. Okay, let's see here.
One thing I want to mention about spouses, because a lot of people are asking about their spouses being covered on the plan, and they want to know, will coverage continue should anything happen to the subscriber? Can the spouse continue coverage on the state health plan? And yes, your spouse can continue as a state health plan member. They become what we call a surviving spouse, and they simply take over paying the premium that you had been paying for them before you passed away. Now, the caveat here is that for your spouse to continue state health plan coverage, they have to have been a covered dependent on your plan at the time you pass away. That is the only way that they can continue coverage with the state health plan. If they are not a covered dependent at the time you pass away, then the spouse would not be eligible, nor would they ever be eligible for state health plan coverage. So that's something to keep in mind. We've got someone who's saying, hey, can I still participate in the Pierce Eye and Dental plan? Roberta mentioned, yes, that's fine. We actually, encourage you, if you have that coverage, don't drop it just because you go on a Medicare Advantage plan. The Pierce Dental plan and their vision plan, those are meant to provide you with coverage for routine dental and vision services. You won't get that coverage under the Medicare Advantage plan. They just cover an eye exam, but if you needed, glasses or contacts, it's not going to cover that. And of course, routine dental care is not covered under the Medicare Advantage plans.
Someone asked, if I enroll in the state Medicare Advantage plan and decide to go on a commercial Advantage plan, do I have to get a physical? Well, first off, if you're enrolled in the group Medicare Advantage plan under the state health plan's umbrella, and you decide to enroll in a individual Medicare Advantage plan, you will be bumped off of the state health plan's group Medicare Advantage plan. Remember, you cannot be in multiple Medicare Advantage plans at the same time. There are federal guidelines that prohibit that. It is out of our hands. It's out of United Healthcare's hands. You will only be allowed to be in one. Whether or not you have to have a physical, no, you would not have to have a physical to enroll in any Medicare Advantage plan option, whether it's the group or the individual.
One thing I want to mention, because this has come up a lot, is we have some retirees who have been covering their spouses, and when their spouse is turned 65, they drop their spouse from state health plan coverage because that spouse has decided to go and get their own individual Medicare Advantage plan in the marketplace. They don't want, the spouse doesn't want to be on the state health plan. And what happens is when they automatically enroll in that Medicare Advantage plan, yes, it does bump them out of our group Medicare Advantage plan. But that means we automatically enroll that spouse into the 70/30 plan. Remember, you've got to contact the state health plan, the Eligibility and Enrollment Support Center, if you are going to terminate a dependent from coverage. Just because your spouse is enrolled in an individual commercial plan and that bumps them out of our United Healthcare plan, they haven't been terminated from state health plan
It's still
coverage.
state health plan
They're
member.
still covered on the state health plan, but we've moved them into the 70/30 plan because all we know is that they've been bumped out of our Medicare Advantage plan, that Medicare has denied their enrollment on our plan. So unless we hear from you, we don't know that you want them terminated. So it's very important, if you are going to drop a dependent, that you contact the Eligibility and Enrollment Support Center to terminate them.
Okay. Click on this one here. We're looking, we're trying to,
Yeah.
we're still going through.
We've got a lot of duplicates here, folks, so bear with us. So yeah, somebody's asking about IRMA that we talked about with your salary. So someone has been approved for Medicare beginning in May for Medicare Part A and Part B, and they've retired from the state, but they're working in the private sector, and they're over that $87,000 range. So again, you have to remember that when you are signing up for Medicare A and B, the IRS is looking at your tax returns from 2018. And if your modified adjusted gross income is over $87,000 a year, then you're going to have a higher Part B premium. Now, in regards to what all is included in that, if you have a tax person or a financial advisor,
Right.
and you want to know if you're going to be affected by IRMA, you're going to have to talk to them. We can't advise you on that. There is information on the Social Security website or
Actually,
Medicare website.
Well, Social Security used to have a publication on their website, but it has been taken down. I'm trying to find out whether or not they're planning to put it back up. There was a publication relative to higher premiums for Medicare beneficiaries, premium rules for higher income individuals. And it was not up there when I looked yesterday, but you would need to speak with your financial advisor or with Social Security, and they may be able to give you some information or guidance on it. There's some information on the Medicare's website, but it's limited. It does not go into a lot of detail because this is a program that is managed through the Social Security Administration. So we can only recommend speaking with a financial advisor or with Social Security. Okay, here's one. I am a retired state employee and have been drawing Social Security benefits. I was recently placed on disability and will be receiving Medicare in June. Will any of this apply to me, and is there a guide to making the decisions to choose the plan best for my needs? You should need, in this type of situation, because you're already under the retirement system, you will want to contact our Eligibility and Enrollment Support Center, let them know that you've received notification. I'm assuming you've received a notice of award letter. This is normally anywhere from 3 to 6 pages in length. It will advise you whether or not you have your Medicare Part A and Part B both beginning in June, or is it just Part A and your Part B is being made effective June 1st, but your Part A is effective a couple years ago. You need to look at your notice of award very closely. But reach out to our Eligibility and Enrollment Support Center at 855-859-0966. Give them your Medicare information. We would automatically enroll you possibly into the United Healthcare base plan, or you would have an opportunity to elect that. But this does affect you.
So someone wanted to know if during their initial year of enrollment in Medicare, you decide not to take the Medicare Advantage plan. Maybe you just want to stick with what you know with the traditional insurance, and have original Medicare as primary and 70/30 as secondary. Would you be able to enroll in the Medicare Advantage plans in the future? Yes, that's a great question. And what you have to remember is that no matter what plan you decide on, it's only for the current plan year. You get the opportunity to change your benefit plan every year during open enrollment. So you are not locked in. We're not going to look at your health status. You get the chance to change that plan every year. So you're not locked in for the rest of your life. We also had someone ask again about how the state retirement system picks up your coverage on the first of the month following your retirement date, and they wanted to know again who's covering them for your first month of retirement. So if you're retiring directly from the state, then you are covered by your employing agency for that first month of retirement. So say you work for the Department of Transportation and you're going to retire July 1st, and you're on the 80/20 plan, you're 67 years old maybe, you're going to stay on the 80/20 plan for that month of July under the Department of Transportation. But remember, if you're 65 or older, Medicare will be primary to your 80/20 plan. Then when the retirement system picks up your benefits as of August 1, that is the point in which you would either move on to the 70/30 plan or one of the Medicare Advantage plans, whichever one you chose. If you are retiring early, maybe 62, and you're on the 80/20 plan, you're retiring for Department of Transportation, they'll cover you for that first month of retirement, and then the state retirement system will move you under their umbrella, and you'll just stay on the plan you had as an active employee.
Someone indicates they're becoming 65 in July, plan to continue to work full-time with will the state plan with Medicare Part A as the secondary payer, will this provide total coverage for the existing 20% I have to pay? No. You will continue to have your 20% co-insurance responsibility under the 80/20 plan. I'm assuming that's what you have. Part A is hospital insurance. So if you had a period of hospitalization, remember the 80/20 plan that you're currently on as an active employee is going to be your primary coverage. Medicare Part A would be secondary. It may pick up and pay a little bit of something, but kind of doubtful unless you have a very lengthy period of hospitalization, I would say. Medicare Part A will just be there as secondary coverage. but it may not pay much at all. But remember, it's premium free. You're not having to pay for it. Okay, let's see. Someone asked, if you move out of state, how does this affect coverage? We, as Jane mentioned earlier, we have members in almost every state. So these plans will move with you. It is important though, if you are moving, whether you're moving within the state or outside of the state, to make sure you update your address as soon as possible with the state health plan, with the retirement system, with Medicare, with Social Security. Everybody needs to have your most updated address. Very important.
Okay, we've got someone had kind of a twofold question, wanted to know if there are webinars on the difference in coverage between the base and enhanced plans. Well, no, there's the plan comparison, and Roberta did kind of discuss the differences. We do feel the base Medicare Advantage plan is the better value. You have to remember that all the benefits are the same on each plan. It's not like you could get 3 extra surgeries if you went on the enhanced plan. You could have the 3 extra surgeries on the base plan too. There's only a difference of maybe $5, $10 with just a few of the copays, not all of them. What you really need to look at is what your medical out-of-pocket maximum is on both plans. It's $4,000 on the base plan and $3,300 on the enhanced plan. That's only a $700 difference, but you're going to pay $900 a year in premium to be on the enhanced plan. So it doesn't make great sense. Now, how will that change in 2021? We don't know yet for the enhanced plan. I can only tell you the base plan's not going to change. The other question they had was that they were retiring as of April 1. They're already Medicare eligible, and they have Medicare and a supplemental plan. And what date did they need to choose the plan they wanted as a retiree? So if your official retirement date is April 1st, that means your benefit date is May 1. You've most likely been defaulted to the Medicare Advantage base plan with United Healthcare for May 1. If you've gotten any type of individual coverage on your own outside of the state health plan, it's probably not going to coordinate with the United Healthcare plan, or if you signed up for your own Medicare Advantage plan, it may have bumped you out. But you need to contact the Eligibility and Enrollment Support Center no later than April 1st, and find out what plan you may have been defaulted to for May 1. Again, if you have your own individual Medicare Advantage plan that you signed up for, or a Medigap or a Medicare supplemental plan, you probably want to make sure that you have the 70/30 plan with the state retirement system. So please call the Eligibility and Enrollment Support Center prior to the 1st of April. Also, if you're going to be covering your spouse, if your spouse is Medicare eligible and you're on the 70/30 plan, that's a pretty hefty premium you're going to be paying to cover your spouse. So you need to take that into consideration also. We do suggest you contact the Eligibility and Enrollment Support Center though.
Someone asked, what is the hearing aid benefit and hearing aid discount under the United Healthcare plans? The hearing aid benefit, it's a $500 benefit every 3 years to be used towards hearing aids. And the hearing aid discount, they use a service called iHealth Innovations, and you can obtain hearing aids through them at a very reasonable discount. And in fact, you can combine your benefit, your hearing aid benefit, with your hearing aid discount to even reduce it further, a set of hearing aids.
So someone wants to know, when my wife retires from her job, can I pick her up under my insurance? Yes. So if you have a spouse who is working in the private sector and when they retire, they won't have any coverage through as a retiree from that private employer, then you can definitely add them as a dependent to your plan. That's what we refer to as a qualifying life event. It's loss of employer group coverage. So that would allow you to add your spouse as a dependent outside of an open enrollment period. So that's a great question.
Here's another question. I will begin Medicare on May 1st of this year. What I have paid out of pocket so far in 2020 apply toward the out-of-pocket amount in the Advantage plan for the remainder of this year? Unfortunately, no. So that is something to take into consideration as well. If you've had some serious health issues this year so far, and you've met your maximum out-of-pocket limit under the 70/30 or the 80/20 plan, if you go to the United Healthcare plans, that's not going to carry forward with you. If you elect to stay with the 70/30 plan, it would stay there. It would transfer over to the 70/30, but it will not transfer over to the United Healthcare plans.
Yeah, so I've had some retirees, because someone was asking about, well, who would typically take the 70/30 plan because the Medicare Advantage plan seems so much better. Well, that's one reason. Maybe you've had a lot of health issues this year. You've been on the 80/20 plan. You're gonna turn 65, become Medicare eligible. You've already met your deductibles or out of pockets on the 80/20 plan. Yeah, I wouldn't want to switch to the Medicare Advantage plan. I would choose the 70/30 plan, let all that transfer over, because they're both Blue Cross plans. And then during open enrollment, you can always switch to the Medicare Advantage plan for next year.
Right.
Yeah.
Other situations where someone may have other retiree group health coverage is a reason why someone may take the 70/30, because their other retiree group health coverage may not work with a Medicare Advantage plan option. Or it's a possibility that they have TRICARE for life. And as I mentioned earlier, some individuals will elect to go with the 70/30 instead of the Medicare Advantage plan when they have TRICARE for life. So there are a number of reasons why someone will elect the 70/30 versus the United Healthcare Medicare Advantage plans.
We had someone ask what the dates will be for open enrollment in the fall. We don't have that information at this time. That is something that the Board of Trustees will vote on, but they haven't voted on that yet. So I expect that in the next few months, probably next couple months, they will start to make a determination as to when open enrollment will be held. So stay tuned. That will definitely be put out there once they've made that decision. So I think we got time for one more question. Let's see here if we can find one that's not a repeat.
Okay, someone says, my husband will turn 65 in 2021, and I am 5 years younger and an active employee. I cover him under the 80/20 plan. How do I change his coverage during the year? So this is his becoming Medicare eligible in 2021 would be a qualifying life event.
To drop it.
To drop him. You would not be able to move him to the United Healthcare plans or Humana Medicare Advantage plans during that time period. Those plans are only available for individuals who are under the retirement system. So the subscriber has to be under the retirement system in order to enroll a spouse in those plans. So in this situation, you would want to consider dropping your spouse from your state health plan coverage, let him enroll in Medicare A and B, and then seek assistance from the SHIP, Seniors Health Insurance Information Program, which is an agency under the Department of Insurance, and they would be able to assist him in narrowing down what Medicare prescription drug plan would be the best option, look at Medicare Advantage plans on an individual basis or a Medigap plan.
Yeah, it's not worth continuing to cover a spouse when they become Medicare eligible if you're an active employee. So you can always add them back as a dependent
Right.
once you retire, and then they could go on the Medicare Advantage plan, but it is not available to them as long as you're still a full-time employee. So that brings us to the end of our time here, and I want to thank you all for tuning in. I know this is a lot of information. There will be a recording of this webinar posted, so on our website. It does take about an hour or so for sure to get the emails out to everyone, but it will be available.
We do want to mention during September and October, every year we host Medicare primary open enrollment meetings across the state. So we will be holding those during the months of September and October of this year. We will get those posted on our website once we have the dates, times, and locations nailed down. Those typically are posted during the month of August. We will send out information in August as well to our Medicare retirees to let them know of these events. We do encourage you to come out to these events to learn about the Humana plans for next year and any other changes that may be coming forth.
Mm-hmm. And again, just a reminder, I mentioned at the beginning of the presentation that the on-site meetings we had planned on this same subject matter for the months of March and April are being canceled. Their invitations were already printed with those dates listed. I think they're looking at maybe putting an insert in them before they get mailed that will also notify you of this, but due to the coronavirus concerns, we have the health of our members and staff, of course, to take into consideration. So those on-site meetings have been canceled for March and April. We are adding 5 additional webinars to the ones already scheduled to try and make up for this. We apologize, but at the end of the day, everyone's health safety is of the utmost concern. So keep that in mind. And
the new webinars have already been posted on our website. Right. I just received notification.
Yeah. So again, thank you all for tuning in. I hope you found this helpful.